I'm Leslie Moccia, and I have a son, Zachariah, who has Dravet syndrome. He is 31. His seizures started at 2 months of age. As most kids with Dravet, the first few years were very difficult. You know, a lot of seizures, a lot of very prolonged seizures, a lot of trips to the emergency room.
When did the Dravet diagnosis come about?
It was talking to another mother, and she was the one that told me about Dravet syndrome. And I looked it up and said, wow, that is that. And took it to his doctor and requested that we got tested.
And what doctor was that, Miss Moccia? Was that his primary care or his seizure doctor?
His neurologist.
Yeah, neurologist. And was it a pediatric neurologist, or at that point was it an adult neurologist?
At that point, it was an adult neurologist.
Okay. And how is he doing now, or after he became an adult, in terms of seizures and other possible issues he could?
Now he's doing very well. I mean, he still has seizures. We'll see a seizure about once every couple months.
Okay.
And it was starting some of the newer medications that are out. He's on, once we started Epidiolex, it really made a change for him and his seizures.
So, Ms. Moccia, how did the delayed diagnosis of Dravet affect Zach and you as a family?
Well, I feel that, by getting the diagnosis so late, that Zach had to endure all the wrong medications.
Right.
And that affected the family a lot, because as a family, we never knew if we could follow through with any plans. We were always hesitant to make plans. We didn't know what the next moment was going to bring for us. And it had an effect. And I'm now a single mom. Had we had that diagnosis earlier and had the understanding, it might have, we might have still been a family unit, because we would have had more time for ourselves.
And just based on your family story, Zach, your experience, and now being really heard through this channel by so many adult neurology residents out there who are soon to become adult neurology practitioners, what message would you like to give them and me and us as a team?
Well, I feel it's very important to listen to the parents. I tried to take what I learned through the support groups and all the research I do, because I haven't stopped. I have one person I'm looking after. And so I try to take that information I have to my son's doctor, and then we try to talk through, what I have brought to him. So I feel like the parent, the neurologist and the parents need to come together and be a team. You, as a neurologist, have all the education, but us as parents, we have the experience.
Absolutely.
And we know our kids, and we know what has worked and what hasn't worked. Every Dravet child or an adult is going to be different.
Right.
So to always remember to treat that child on their cognitive level, and remember although my son is almost 32, he really isn't. It's more like talking to a 4 to 10-year-old, depending on the subject you're talking about. And so, talk to him and keep in mind that you're dealing with a child.
Thank you again on behalf of all of us. This has been really nice to meet you and hear from you, and we all really appreciate it.